Good afternoon to one and all. I am Dr. Virendra Satish Chandra Jain, Professor, Homeopathic Materia Medica Department, Motiwala Homeopathic Medical College, Nasik. Today, I am going to present before you acid group, which is one of a very important group in our homeopathic science. Basically, knowingly and unknowingly, all of us has been introduced to this acid group when we were studying in second year pathology regarding immunology. One acid group that already exists in our body. I will give you certain example of this acid group. The first to start with the acid group in our body is our saliva, which is acidic in nature and is responsible to kill number of microorganisms if at all they are present in the food that we are having. The second acid that everybody of us knows is HCl, the gastric juice, which is also acidic in nature. The third example which I would like to give you is regarding the sweat, soap, fatty acids. So, fatty acids are present on the surface of our skin, again a part of innate immunity, which itself is responsible to kill number of microorganisms. And last example, which is acidic in nature, is our urine. Urine also is acidic in nature, which is responsible to flush the urinary tract. So this acid group already exists in our body. I give you the example of saliva, I gave you the example of the gastric juice, I gave example of urine, as well as the fatty acids that are present on our skin. Not to forget the tears. Our tears are acidic in nature as well. So this is an acid group that already exists in our body. As well, acids are present in vegetables, acids are present in minerals. Some of our acids which is there in our syllabus, they belong to the vegetable kingdom, some of them they belong to the mineral kingdom. As we have discussed beforehand, that the medicines prepared from the mineral kingdom are having different pathological and physiological action, and the acids which belong to the vegetable kingdom are having different action. Some of the acids, like let us start with the PowerPoint presentation, acid group of homeopathic remedies. The origin of acids is from mineral and vegetable kingdom that I have already mentioned to you. I started with the acid groups that is already present in our body. Now from the nature, we can derive acids from mineral kingdom and vegetable kingdom. Homeopathic remedies which are derived from the mineral kingdom are the most common, are enlisted in front of you. They are fluoric acid, muriatic acid, nitric acid, phosphoric acid, sulfuric acid, etc. Now, though they belong to one family, but everybody has different affinities. For example, if I am Dr. Virendra Jain, I belong to one family, I have 5 members in my family, but all of them, their likings and dislikings are different. So they are not similar. In same way, the acids which are belonging to the mineral kingdom, let us start with fluoric acid. Now, fluoric acid usually we can say is a godfather. Fluoric acid is related to Silicea. Silicea is related to Pulsatilla. We can say the father of Pulsatilla is Silicea and the father of Silicea is fluoric acid. Pulsatilla, the outstanding point is changeability. It is having a pendulum-like action, hot as well as chilly. If we go to Silicea, Silicea is the chilliest remedy, and the main outstanding feature of Silicea is malabsorption, is malnourishment. Malabsorption rather should be stressed upon. Pulsatilla had changeability. That changeability will vary from person to person, from likings to dislikings, from symptoms as well, from mind to physical generals. So changeability is the characteristic of pulsarilla. And their grandmaster is fluoric acid. One outstanding point of fluoric acid I would like to highlight here is, all of us, when we talk about acids, we jump blindly with the first line, acids are having weakness and debility. But friends, let me tell you that fluoric acid is an exception to that. This is the first remedy in the acid group which I am dealing with you now. But fortunately or unfortunately, we can say the commonest point of acid, that is weakness and debility, which should be the first outstanding and headlining point of the acid, is lacking in fluoric acid. Now, what is the reason? Fluoric acid, if we break it, it's fluorine. Now, when we talk about fluorine, fluorine is a halogen. And when we talk about halogens in homeopathy, we need to say that halogens, they are having 100% action on the thyroid gland. So naturally, fluorine or fluoric acid is not an exception to that. Now, when they are having action on the thyroid gland, now the action on the thyroid gland can be exhibited mainly in 2 points. One is hyperthyroidism and the second is hypothyroidism. When we talk of halogens, when we talk about fluorine, when we talk about chromium, we need to talk about hyperthyroidism. So when we talk about hyperthyroidism, naturally the anxious level is increased and the basal metabolic rate is increased. The patient tends to become hot. Now, what is happening in fluoric acid is, fluoric acid commonly should be known by 3 W's from the student point of view, that is woman, wealth and wine. This fluoric acid, the Bacteria Medica book, the lectures of Kent's Bacteria Medica says that the patient is indifferent to his own wife, to his own children. Now, why he is indifferent to his own children? It is not because of any kind of disappointment in the background, but the vested interest of fluoric acid. Fluoric acid is said to stand at the corners of the lane, looking at the young girls, the women that are passing by with dribbling of the semen. That is the excess of sexual in fluoric acid. Fluoric acid, we can say, is having androgens secreted in a psychosyphilitic miasm, which disturbs the intelligence, and the patient himself abuses with excess of sex, with sex that is extramarital. This has been brought to notice to the friends, to the family members. The family members, they try to convince him, but unfortunately he is not convinced. He remains indifferent to his wife, to his children. So if you say that the outstanding point of fluoric acid is woman, wealth, I should say wealth first, then woman, then wine, and then woman. And then when the mind is having a syphilitic thought, naturally with fluoric acid, we will have certain symptoms of syphilitic origin, like the degeneration of the teeth, like the sinus and fistula. So if we see the starting with the fluoric acid, that fluoric acid mainly has a syphilitic miasm in the background. So in the middle kingdom, when we talk of fluoric acid, it disturbs the mental framework and disturbs the physical framework. When we talk of physical framework, we are talking of bones. When we are talking about the mental framework, we are talking of the balance between the will, intelligence and understanding. This was the first acid, fluoric acid from the middle kingdom. The second is muriatic acid. Now see, variations. As I told you, that even if we belong to one family, we are having different affinities. We are having different likings. we are having different dislikings. Now let us talk of muriatic acid. Muriatic acid itself differs from fluoric acid and other rest of the acid. It is having a unique, outstanding sphere of action and pathology. I would like to say that muriatic acid should be looked up like lachesis, should be looked up to like baptisia. The reason, what is the reason that I should talk of muriatic acid, baptisia and lachesis? I usually call baptisia as a vegetable lachesis. Now why? The action of muriatic acid is on the blood. It is having a septic action, septic condition of the blood. It is having indirect action hence on the muscles because the muscles are fatigued. Now whenever we talk about muriatic acid, we talk of the septic condition of the blood. And whenever we talk of the septic condition of the blood, one of the common conditions that has been expected from a student in muriatic acid is the typhoid state. Now you also know that baptisia is also known for typhoid state. Muriatic acid is also known for typhoid state, as well as arnica is also known for typhoid state. But as I have before mentioned regarding muriatic acid, the septic action is outstanding. The muscular weakness is up to such an extent that when we ask the patient to show the tongue for inspection of the tongue is trembling. Friends, tongue is also the muscle of our body. As I have already mentioned, that in muriatic acid there is muscular weakness, and that muscular weakness can be seen in the form of the trembling tongue. We have trembling tongue in gelsemium as well. It has a muscular weakness as well, but in gelsemium, the weakness is because of the action of the medicine on the anterior horn cells. Whereas in muriatic acid, the action is on the blood, the septic condition of the blood, the action on the RBCs, the hypoxia that is resulting into because of the disturbance in the RBCs, we have hypoxia as a result of, that's why in the muriatic acid we have the appearance of the patient as bluish because of accumulation of carbon dioxide, because of affection of the blood, the septic condition result thereafter followed by the muscular weakness. So remember, M for muriatic acid and M is for muscular weakness. The septic condition, the typhoid state, the common line that all the doctors expect from a student is the lower jaw hangs down. That itself indicates the tremendous amount of weakness and prostration that we see in muriatic acid. So to summarize here for muriatic acid, always remember that muriatic acid has septic action on the blood, a state similar to that of typhoid. In fluoric acid, we had talked of a syphilitic miasm. Now let us go to nitric acid. Now nitric acid is a remedy that should not be forgotten for its action on the mucocutaneous junction. Now, nitric acid, if we start, the discharges are, all the acids are having the discharges like thin and watery. And why they should have action, they should have thin, because of thin and watery is because of their acridity in nature. Whether it is nitric acid, whether it is phosphoric acid or whether it is sulfuric acid. The outstanding feature of nitric acid is that it is having thin, watery, transparent discharges. Of course, they are acrid in nature. Nitric acid as well has an acrid nature from the mental point of view. I'll just give a simple example of that. And that example is that in nitric acid, you have, the nitric acid definitely is a patient who is helpful, who is cooperative. But these are the patients who have leadership in them. As far as if I am nitric acid and if you are in my group and you are obedient to me, you are loyal to me, I owe to you. But once if I found that you are not loyal to me, then I will be inversely proportional to you. I will be hateful to you, I will be revengeful and I will be vindictive. So nitric acid is having both the sides. If I am nitric acid, I am the leader, you are my follower, I will owe to you. If you disobey me or if you are disloyal to me, I will be your worst enemy. So that is the condition is there in nitric acid that should not be forgotten. The action on the mucocutaneous junction is outstanding of nitric acid. You will always find the nitric acid patient to have cracks at the corner of the mouth, to have fissures, and nitric acid as well is having a hemorrhagic tendency. So again, it differs from fluoric acid and muriatic acid, though it belongs to the mineral kingdom. So next is phosphoric acid. Phosphorus. Phosphorus is known for the conduction of impulses from the central nervous system and from the nerves. So if you see, fluoric acid, bones, thyroid and teeth. Muriatic acid, action is on the blood. Nitric acid on the mind, no doubt, all the acids are having action on the mind, but on the mucocutaneous junction. Now we are coming to phosphoric acid. Resemblance of phosphoric acid is with phosphorus. And when we talk about phosphorus, phosphorus physiologically is present in the brain, in the nerves, in the liver, in the bones. So it has again a polycyst action. Now when we are talking about phosphoric acid, we say there is a mental fatigue first. Again there is an indifference. We have seen one indifference in fluoric acid, but that indifference is to the family. Now the question is raised, why phosphoric acid has indifference? As I have already mentioned, that phosphoric acid, phosphorus, is present in the central nervous system. It is present in the nerves. It is present in the liver. It is present in the bone. Now this phosphoric acid, when there is deficiency of phosphoric acid or phosphorus in the body, the central nervous system becomes fatigued. Simple questions, simple mathematics, which were once upon a time very simple to act very quickly. Now because of the fatigueness, because of the tiredness, what has happened in phosphoric acid is that in phosphoric acid the brain is tired, the brain is fatigued. Simple questions matters much. The patient is unable to think. The patient is unable to maintain the chain of thoughts, and that's why the patient becomes irritable. Hence, in phosphoric acid, again, can be used in case of typhoid. But to summarize, phosphoric acid has action on the central nervous system, has indifference because of the mental fatigue. It is an outstanding feature that mental fatigue is the first that should be looked upon in case of typhoid fever. As I have already mentioned, it also exhibits its action on the endocrine system, and it might be because of prolonged grief, it might be because of disappointment in love, or it might be because of autotraumatism. The next medicine is sulfuric acid. Whenever we are reading regarding acid sulf, number of times we find that sulfuric acid is having its mirror image in arnica. A very common use for sulfuric acid is for de-addiction of alcohol. It is one of the therapeutic drugs which can be used for de-addiction of alcohol. Few minutes before, why I said that sulfuric acid and arnica are the mirror image, because sulfuric acid also have elements from trauma, mainly blunt trauma. The appearance of the arnica and sulfuric acid, particularly the line which we say is the sore bruised filling, the bluish appearance is also an outstanding feature of sulfuric acid. One point that needs to be mentioned here of sulfuric acid, which again can be compared with argentum nigricum, is the hurriedness in the sulfuric acid patient. If we see in repertory, trembling, the word trembling, the rubric trembling, trembling has been bifurcated into external trembling and an internal trembling. Sulfuric acid is a medicine which has both internal and external trembling, as well as sulfuric acid has the same kind of hurriedness that we often talk in argentum nigricum, which has an apprehensive anxiety. So we see here that in furic acid, though they belong to the middle kingdom, the action is on the thyroid, the action is on the teeth, the action is on the bones. In muriatic acid, the action is on the blood, the action is on the muscles. In nitric acid, the action is again on the blood, the action is on the mucocutaneous junction, and predominant, no doubt, all of them they are having action on the mind as well. The action of phosphoric acid is having action on the central nervous system, is having action on the endocrine system. We say milky urine. Milky urine is an outstanding feature in phosphoric acid. And sulfuric acid, again, as I said to you, it is having action on the blood vessels, it is having a mirror image of an arnica with sore bruised filling, it is a very good acid for alcohol de-addiction, as well as it is having an internal and external trembling with hurriedness. Now next, if we go, certain examples, these examples are from the vegetable kingdom, and certain acids which are there in our syllabus are there. These are the acetic acid, benzoic acid, lactic acid and oxalic acid. To start with acetic acid, one should remember vinegar. If you see acetic acid, out of so many remedies having anxiety, acetic acid outstands itself with anxiety and worry for children. No doubt, everybody is having worry of children, but particularly while giving the case, when the patient talks about very frequently the patient is highlighting about the worry and anxiety regarding the children, it is one of the outstanding feature of acetic acid. Now acetic acid has a diathesis, it has a tubercular diathesis, it has a hemorrhagic diathesis, it has diabetes as well. So if we see, there are three main conditions that are there in acetic acid. There is diabetes, there is tuberculosis, and there is hemorrhagic tendency. Never forget acetic acid in case of post-surgical condition where we say there is bad effects of anesthesia. So if we see acetic acid, now acetic acid has diabetes, acetic acid has edema as well. We cannot forget acetic acid in case of edema. But the common features, like when we talk about diabetes, the patient is having polyuria, polyphasia, polydipsia, that is excess of urine, excess of thirst. Acetic acid lacks excess of thirst in case of diabetes. And in case of edema, acetic acid, where there is already excess of accumulation, extravascular accumulation, extracellular accumulation of the fluid, in spite of that, acetic acid is thirsty. So, in acetic acid, post-surgical anesthetic effects, diabetes, tuberculosis and hemorrhages are the outstanding features. The next is benzoic acid. Benzoic acid should not be forgotten for uric acid diathesis. In the acid family, benzoic acid is having uric acid diathesis. That itself indicates that benzoic acid is having action on the liver. And not only having action on the liver, it does have action on the purine metabolism, because purine metabolism is responsible for uric acid, that the disturbance of the purine metabolism is responsible for an uric acid diathesis, as seen in colchicum, as seen in lidum pulp, as seen in lycopodium. So benzoic acid, among the acids, benzoic acid is having outstanding action, or you can say uric acid diathesis with affection of small as well as large joints. Next acid that has been listed is lactic acid. Lactic acid should not be forgotten for tuberculosis of vocal cords. Lactic acid should not be forgotten for diabetes. Lactic acid should not be forgotten for rheumatism, and lactic acid has a predominant action on the breast. There is severe pain in the breast with enlargement of the axillary group of lymph nodes, and the pain radiating from the breast and going to the arms. And the last that is listed in this vegetable kingdom here is oxalic acid. Oxalic acid has an outstanding feature that thinking of the complaint causes aggravation. This is the first line that you need to mention. And the second thing is aggravation by eating fruits. The sourness of the fruits, it aggravates the oxalic acid patient. So as for the vegetable kingdom, acetic acid, diabetes, hemorrhagic tendency and tuberculosis. Benzoic acid is having a predominant action, is having uric acid diathesis with a typical smelling urine. Lactic acid has tuberculosis of the vocal cords, action on the breast as well as used in rheumatism and diabetes. And oxalic acid is having aggravation from fruits as well as oxalic acid is having aggravation by thinking of the complaints. The remaining part we will deal with next time.